Hello everyone, my name is Dr. Fazala Mehnaz. I'm a consultant pediatrician and neonatologist at Apollo Hospitals, Visakhapatnam. Today I'm here to talk about allergic rhinitis, which is a very common condition, especially in this season. What is allergic rhinitis? It is an inflammation of the inside of the nose caused by allergens such as dust, house dust mites, etc. What are the signs and symptoms? These are just like flu symptoms like runny nose, cough, sneezing, etc. Sometimes there'll be itchy eyes as well. So there are various types in this. Some children are affected only during some times of the year, that is a few months. So it is called a seasonal one, and sometimes they have it all through the year. So depending on the symptoms, we have various tests and treatment. So coming to the diagnosis, how do we diagnose this? Usually it is symptomatic. So when we hear from the parent that the child is suffering from these kind of symptoms, we come to a conclusion that it is more likely allergic rhinitis. Sometimes there is a family history as well. The parents themselves might be affected. They might say that they have these allergies such as dust allergy, etc. And there is a family history of atopy as well, like asthma, eczema, or hay fever. So, depending on the symptoms, the diagnosis, as I said, is more likely clinically. Sometimes we tend to do the test in case of severe symptoms. Some of the tests are like blood tests, which are IgE tests, or we look for the eosinophils, etc. On the CBC, and the other tests are the skin prick tests. So these are the latest ones coming up now. These have been done quite since long, but recently we are doing it more because children are getting affected. Okay, the quality of life is getting affected in children because of these recurrent symptoms. So, how do we do these skin allergy tests? There will be various panels in this. Okay, so the child has to cooperate a bit. There will be different allergens like food or dust or animal, etc. So you can tend to inject this allergen into the skin, and depending on the reaction, that is the redness or swelling, we decide whether the child is allergic to that particular allergen. And the good thing is that depending on that allergen, we have come up with a new therapy which is called immunotherapy. Previously, the treatment was symptomatic. To say, if it was fever, you give paracetamol depending on the age or weight of the child. And if there was runny nose, you give some nasal sprays, okay, low dose steroid, etc. And some antihistamines, okay, depending on the child's activity and age. There are various forms of antihistamines. So you tend to give those syrups in addition to these sprays. And if there are other symptoms like itchy eyes and all, you tend to give some nasal and eye drops, etc. So basically, that was a symptomatic treatment. But not what I'm talking about now is exact treatment. That is, it would be treated because of this. Depending on the allergen, you kind of do this treatment, which is called as immunotherapy. So this therapy is like you inject the allergen in small quantities in every so much duration of time. These are available also in tablet form, okay, so oral as well. So as the person is able to tolerate that dose, the dose will be increasing, and that's how you develop this immunity against that allergen. So that is the most recent development in allergy. And I would really recommend to people who are having recurrent episodes of allergic rhinitis, including kids. This test is done in the hospital, and it is quite safe. So that would be very helpful for the treatment of the child, because many children who are having these recurrent episodes of cold, cough, they get prescribed lot of over the counter medications, and sometimes they are treated with lot of antibiotics which suppresses the appetite, and it has an effect on the weight of the child as well, and the parents are quite anxious about it. So this therapy would really work for those kind of children who are ending up with lot of medications. And the last thing is prevention. As you all know, prevention is better than cure. So this was the advice given, earlier as well, along with the symptomatic treatment, that you need to avoid the allergens. So sometimes it is easy, but most of the times it is very difficult. Like if you take in mind the current environmental status where there is pollution everywhere, it's literally like impossible sometimes to avoid dust exposure, etc. House dust mites, we normally like recommend parents to wash the bed sheet and mattresses and pillowcases in very hot water and dry them in sun. So this is the other thing. And children who are young, they tend to keep carrying these soft toys which kind of harbors these allergens in them. So that is one thing where you can sanitize the toys, and hygiene measures can be taken. So all these are the prevention things. The other allergens usually we come across is the pets. Okay, many people tend to keep various kind of pets like dogs, cats, rabbits, etc. in the houses. So it's usually not the hair from them, but it's the secretions which are allergic to, because these pets tend to travel everywhere in the house, even the bedroom sometimes. So reducing the exposure to the pets and keeping them clean is another way of preventing these episodes. So here we have a little chat on allergic rhinitis today. Hope you all find it useful. Thank you so much.